our strategy has been very successful. There are 640 cases now in Texas. The number continues to grow by the day, but the growth rate of the measles are 640 nationwide, about 440 in Texas. The growth rate has diminished substantially. I would compare it to what's happening in Europe now, where we've had 640 cases here. They've had 127,000 cases and 37 deaths. And so what we're doing here in the United States is a model for the rest of the world.
Well, we definitely have a significant number of cases of measles out here in West Texas. A lot of the data around measles says that for every one death, there's about 1,000 cases. So if you use that simple math, that would say that there's been almost 2,000 cases in this area. The state of Texas and myself and local health departments are reporting about 505 cases as of today is the official case count. It's going to be a mix. I think for parents that are very open to vaccine, we're going to see them move and start vaccinating their children at this early age. That's going to protect those individuals. We are also seeing more parents that have kind of been on the fence with vaccinations. Maybe they haven't seen measles and didn't see that as a risk and are now moving to vaccinate their children. I think it's key that every level of government, from federal level, state, down to those who are answering the phone at my health department, are very strong about the importance of the vaccination. The measles, the MMR vaccine that protects us against measles is the way to stop from getting measles. The other things that we talk about are treatments for those who have been exposed or those who already have the virus. But the key here is preventing new infections. Yeah. Yeah, I mean, this is growing daily, and I don't have a good estimate for that, but I know we're in this for the long haul, at least multiple months.
We're very concerned. We have one case confirmed right now. We expect a second case to be confirmed, which is in the family. And this is a very, very infectious disease. We, like many other states, don't have enough vaccination in people already to prevent spread. So if people went through the airport at the same time as the child, there could be infection. We're tracking all the cases. We're doing good public health in spite of the cuts that came from the federal government. So we're doing what we can. But you know, we are among 14 other states where less than 90% of our kindergartners are vaccinated. That means it will spread if it gets into the wrong population. And we're now 1 out of the 675 confirmed cases, but there are thousands and thousands of additional cases of measles out there, which are not confirmed because people are laying low. So it's a very, very big concern. And there have already been 2 deaths, which is horrific. So I want Kennedy to call for a national vaccination move, and I want him to restore all of the public health dollars that fight the spread of disease. Yeah, he always equivocates, and that's the problem. The Secretary of Health cannot equivocate. This vaccine has been tested for decades. It's safe, and we should just be doing it, because otherwise what happens is 1 out of 20 people who catch the measles end up with pneumonia. 1 out of 5 end up hospitalized. So if you have a big outbreak in a rural community, it will completely overwhelm your critical access hospital. I'm not sure he's really calculating those other impacts, but he should not be equivocating. He certainly shouldn't be talking about alternate treatments. He should not be celebrating the 2 healthcare providers that aren't using standard of care to care for the patients that are in their midst. It's all bad. And I am glad that he finally said, get vaccinated. Of course, that's every normal public health official. So it's, like I said, it's horrible public health malpractice to equivocate, and Kennedy needs to get it straight because people's lives are on the line. Yeah, please get vaccinated, everybody.